Hello, everybody on the ABC15 Facebook page. Thank you so much for joining us this afternoon for our third virtual education town hall. These have been so great. We really appreciate you chiming in and joining this conversation. We know that education right now impacts so many people in our community. There's so much surrounding this issue. So we really want to dive into that issue today, talk a little bit about where we are as a state right now, what's in the works, and where we're going. And so I invite you to comment or post some questions here in the comments below, and I'll do my best to get to them and field them to our experts. I have three wonderful experts joining me today. We have Stephanie Para. She is the Executive Director for All In Education, an advocacy organization here in Arizona. She's also a governing board she's on the governing board for Phoenix Union High School District. So some great perspective from Stephanie. Thank you so much for joining us today. We also have Will Humble, the Executive Director of the Arizona Public Health Association. He's got 30 years of experience in public health, including 2 decades at AZDHS, and was the agency's director as well for a time. So thank you, Will, so much for joining us for this important conversation. And then you may recognize, may recognize Will. He's been on one of these town halls with Melissa Blasius before. And then we have Chris Cotterman. He joined one of our previous town halls, and we brought him back. He has some great insight as far as how all of this is impacting the school districts and things they're thinking about. He is the director of government relations with the Arizona School Boards Association. So thank you all so much for being here with me today. Really looking forward to diving in with this. So Stephanie, I'll go ahead and I'll start with you as we wait for some of these comments to populate on the side. Can you talk a little bit about All In Education? I know this is a relatively new advocacy organization here in the Valley. Can you talk about the work that you're doing and what you're seeing as far as the impact these school closures and the pandemic is having on some of our families?
Certainly. Thank you so much. First off, thank you so much for having me. Yes, we are a relatively new education advocacy organization. I started in this role in early April. All In Education is committed to ensuring that our communities that are most impacted by inequity in our school system be the ones that are informing and making decisions on behalf of all students. When I started in this role, it was 2 weeks after schools closed, and in the midst of the pandemic really launching and starting off here in Arizona. It was really important for our organization to take the time to listen to the community, in particular listen to the Latino community about their experience during school closures. We held 13 different community conversations across 5 different media platforms. So we did events like this on Facebook Live. We held conversations on Spanish radio, Spanish television, and a live phone bank. And we really heard from the community about the challenges that they were facing. Certainly a lack of communication from school systems was a barrier for our Spanish-speaking community. And certainly all of the issues around the digital divide and parents having to provide instructional support for their kids at home. Even our most tech-savvy parents were overwhelmed with having to serve as educators in their home environment. But certainly we even had parents who were grateful for being allowed to borrow a laptop computer or a hotspot device. But it was a tool that they had never used before. And so their children were still offline, 6 weeks into the pandemic, because they didn't have the adequate skills or support systems in place to support their child's learning at home. So all of those have really been the top level issues that, as we are now preparing for the upcoming year, All In Education is really wanting to make sure that we are addressing these issues around equity to ensure that our most vulnerable communities continue to have access to learning, even if it is in the distance learning environment, as the safest option at this point.
Sure. And as you mentioned, so many families are in this situation because all schools right now are starting remotely, and the reason for that, as you mentioned, not safe yet to reopen our schools or reopen the campus buildings for traditional in-person instruction. I think so many parents out there, so many teachers, everyone involved in education right now really wants those clear-cut answers of, okay, when are we going to be able to reopen schools? When will it actually be safe? Will, I want to bring you in here from a public health perspective. I know we're waiting on these benchmarks from the Department of Health Services that are supposed to come out by August 7th to help districts make their decisions in when it's safe to reopen. But, from a public health perspective, what sorts of things do we need to see before we can say it's safe to reopen school buildings?
Yeah, so there's really two categories of things that need to happen. Number one is that the districts need to have plans in place that they can actually execute when they do begin in-school instruction for the various grades. So K through 5, middle school, high school, you need to have plans for each of those age groups so that you've got mitigation in place so that when the metrics do click in and when it is safe from a community perspective, you're able to protect students with your mitigation plan. So that's the first category, is to have your mitigation plan ready. And I recommend one, not that's a pie in the sky mitigation plan, but one that you can actually execute, because as everybody knows, a daily classroom is super complicated. And I think it's better to have a mitigation plan that you can comply with than to have a much more aggressive plan that you're not going to comply with. So a realistic mitigation plan for each of the age categories, and of course, a separate one for students with developmental and intellectual disabilities as well. And then the second piece is really looking at the community spread to set a date for when it's safe to have in-person instruction. And for that, it's really some basic metrics. It's not rocket science. It's not as complicated as, well, I don't think it's complicated at all. There's basic metrics. Number one, look at the percent positive rate within your county, and we are recommending that it be below 5%, so below the 5% positive, using a 7-day moving average for about 3 weeks. So that would be one piece. Then just looking at the trend line for your county and ensuring that over a 30-day period, using a 7-day moving average, that you see a decline in total cases. That's the second piece. Third, we're recommending that the state fix this turnaround time problem first, and we're urging that 90% of samples come back from the laboratories within 72 hours. So they've made promises about fixing that component. That's got to get fixed too. And then finally, just a gut check with the hospital system and ensuring that hospitals in your county are open for elective procedures. So those are the criteria that we're urging the health department to adopt. These things are already measured. The turnaround time is going to be a new one for them, but they should be doing that anyway. They should be measuring that as a they're not yet, but they should be measuring that as well. So it's nothing new. It's something each county could have on their county health department website. And if you had that along with good mitigation plans within each district, then I think it's safe.
Mm-hmm. And you told me just a couple minutes before we started this, which I didn't even know, but you guys are preparing an official letter for the governor and Dr. Christ. Is that correct?
Yeah, our board of directors is reviewing that draft letter right now. So probably by the time we're finished with this, I can get consensus from the board, and we'll send that off to the health director and the governor.
Okay, great. Yeah, there is a lot of talk of metrics and being able to really lay out and measure, when it will be deemed safe to reopen. Chris, in working with the different school boards and the different districts right now, what is it like for them at this moment as they're trying to prepare for the new school year, but there's still just so much unknown and uncertain, even as we wait for ideally these metrics that they can use to guide their decisions?
There's really two things that are happening right now. The first one is school districts, as you said, are waiting for indications from the Department of Health Services about what would constitute an acceptable level to go back to standard in-person learning, or not even standard in-person learning, but in-person learning where you can have students on campus that looks more like traditional school. In the meantime, they're also figuring out two things. One, how to keep learning going with online alternatives. And then two, how to meet the governor's mandate to provide the in-person learning for those students who don't have a place to go during the day. That is a bit of a wrinkle because we are trying to figure out how to safely distance those students in various facilities without having them be overcrowded. Because if you get too many students in the same place, you've obviously defeated the purpose of social distancing. So the number one concern here, though, is keeping students and staff safe. We don't want schools to become a vector for the spread of COVID further in the community, especially as we're starting to see some positive trending. So I'm not a public health person by any stretch of the imagination, but we are trying to do a very difficult task, which is provide a service which many, many people have experienced their entire lives in person, in a combination of in-person and distributed way. And that will continue until we're fairly confident that we can keep students safe on campus. And so that's really the three main points that we're looking at.
Yeah, there's so much involved in these decisions. And even for families at home, you know, that decision to, once schools do reopen, do you send your child back? Do you keep them home? And from what I've seen anyway, all the districts that I've seen are offering those choices when they do reopen, that there will be at least a fully online option as well. You know, Chris, you mentioned those in-person supports, and I've seen a couple comments over here on the side of people saying, you know, why are schools opening up to provide daycare, but they can't provide school? And just to kind of clarify what this in-person support requirement is meant to be. And actually, Chris, if you want to kind of lay that out for us, it's my understanding that this is supposed to be support for at-risk students, students who may have disabilities, students who need a safe space to go. But the districts are kind of in charge of gauging who has the most need. Is that what you're understanding as well?
Yes, so that's exactly right. The point of the governor's executive order is to provide relief for essential workers and also special education students with special needs. And then finally, students who may otherwise not have access to the online content due to, you know, unavailability of internet and things like that, to help to reduce the equity issues that Stephanie was talking about earlier. The problem is, of course, in certain areas, that impacts a lot of students. So we need to find enough facilities to make sure that we can safely social distance those students. It is not required to have in-person instruction. It's more a space for students to do their virtual learning until it's safe to resume in-person instruction. But we have districts looking at partnerships with facilities like the Boys and Girls Club, using larger sites in their districts, such as auditoriums, cafeterias, things like that, to make sure that we can keep the distance. Because I've seen a couple references to daycare and bus drivers and stuff babysitting students, and you know, it could be some of that, but remember that the teachers are going to be busy teaching online. So it could be paraprofessionals or other school staff, because it's not meant to be an instructional environment so much as it is a safe space for students to access the content. That's a little bit different for special education students, where they may provide some supports to avoid having to provide what we call compensatory services later, where you have to make up the minutes that are missed. So those are still two categories.
Yeah, I know. When I spoke with Superintendent Hoffman yesterday, we talked about this for a while. And she said, well, it's not, you know, that traditional in-person instruction like everyone's used to, but if it's a situation where you have a student with special needs, they may need some type of kind of one-on-one support as part of the services that they're provided. But yeah, like you said, it's not meant to be that traditional classroom setting. You know, Stephanie, you touched on some of the equity issues earlier. You know, when it comes to this balance of keeping students and staff safe, but also providing these much needed services in the community, I mean, what are you guys seeing as far as the families that you serve and kind of what they need right now as far as resources?
Yeah, certainly. So, you know, I think as we're navigating these very complex questions and situations, for us, it is paramount to keep, obviously, the safety and the well-being of students and educators alike at the forefront of the conversations. but also as we are asking ourselves how we offer educational services and instruction, we have to consider that there are issues of equity impacting, as Chris said, the learning environments for some of our more vulnerable students. For example, in Phoenix Union, when we flipped, the very first thing that our school system had to think about was providing access to meals. Our population is over 80% free and reduced price lunch. And so those access to the meals that we provide, both breakfast and lunch, are critical needs in our community. And we had to come up with ways to continue to deliver those meal programs in a safe way. So certainly those critical resources have to continue to be delivered for our communities that need it the most. And when we were having these conversations with parents, the two populations that kept coming up over and over and over again, and as with the highest concern for falling behind, were our students with special needs and our English language learners, because they just were not getting the resources that they needed in the distance learning environment. And so either we have to get better at distance learning as educators. We're not, the professional development needs of our educators is absolutely critical going forward, because we're asking them to teach in a way that they are not used to teaching, obviously. And so that requires some investment in professional development and supports for educators. It also requires some investment and support for parents and families, because they are also being asked to be instructional aides and assistants in the home. And so we have to get creative about how we give them the tools to be successful moving forward.
Absolutely. We have a comment here, a question, but I think something we can address here. Lorena Flores, about 5 minutes ago, said, have you considered having half the class start in the morning, the other in the PM? So like an 8 a.m. to 11, the next group at 12 to 3. And, just to point out, Lorena, all of the district reopening plans that we are following, we have them up on abc15.com/schools. It's different for so many districts. Some of them may have that AM PM when they're allowed to welcome students and staff back to campus. Some may do school Monday through Thursday, use Friday as a cleaning day. There are all sorts of different ways that districts have laid out that they are going to try to attain that social distancing when possible and put safety measures in place. So I really encourage you to maybe go to your district, to their website, to their COVID page, and take a look at what they're planning for reopening. You can also track your district at this website here. But it's pretty amazing what all these districts are coming up with. And it is such a local decision. And so with that in mind, Will, question for you. I had a parent ask me yesterday, Superintendent Hoffman basically said they can't make a statewide kind of metric that everyone's going to go back on at the same time, because different communities have different spread and different needs. And she brought up how Maricopa County is so large, and there may be one area where spread isn't as bad as another area. Can you get that micro with metrics? I mean, if we're talking about county metrics, how does that apply to individual districts who may be concerned about hotspots in their individual community?
Yeah, so I agree with her that it makes a lot more sense to do this at a more granular level. I don't think doing it statewide makes a lot of sense. That's just too broad of right now, for example, Santa Cruz County is completely different from Yavapai County in terms of the spread. So I think it makes sense to get more granular. Now the question becomes, how granular, does it make sense to go? I think the county level for sure makes sense, and it's possible perhaps you could get down to a more detailed level. Maricopa County there's 4.5 million people in this county, so Tolleson might be completely different from, say, Carefree in terms of what's happening with the spread. I think it makes sense to start at the county level, but then I do think that you can take a closer look if there's special circumstances. So, for example, let's say Tolleson is in the middle of a big outbreak, but the rest of the county, or say the Mesa area, is doing a lot better. I think it's possible to make those kinds of determinations. I think the place for that to happen would be at the county health department level, not the state health department. The county health departments are public health retailers. That's what I used to say when I had my state health department job, is the state health department's the public health wholesaler. The counties are the retailers. And so I think it makes sense to answer that question by saying that's really something to collaborate with your county health departments on. If there's a unique special circumstance, say in Pima County, Ajo is different from Tucson, for example. So I think you can go granular, but I think it makes sense to start at the county level.
Yeah, and that was one thing that Superintendent Hoffman said yesterday, that they're really hoping that districts will work with their county public health departments to help guide them through those decisions as far as when it may or may not be safe to reopen. Chris, we talked about this a little bit before we started the Facebook Live. I'm seeing some comments here regarding waivers, and some parents have received notices from their schools that they'll be required to sign a waiver, kind of absolving the district of liability if they were to contract coronavirus. This is part of, and it's kind of nitty gritty because we're talking about school insurance policies and all that, but this is part of a bigger issue. If you want to kind of try to lay that out for us, so that parents who maybe are getting these waivers, or just so they know the backstory to all this.
Yeah, there's a couple of different. There's been waivers out there that have been floated for sports, which is that's sort of an Arizona Interscholastic Association issue. But the big issue for school districts now is that most school districts in the state are insured by one insurer, and they're called the Arizona Risk Retention Trust, and they provide the liability insurance for school districts around the state. And they came out and said that essentially they would not be able to guarantee coverage for claims related to COVID-19. And so that prompted a bunch of districts to issue, or not a bunch of districts, but several districts at least that we heard about, issue some waivers that I would ask parents to sign to waive liability, mostly because if a claim arose from that and they were found to be liable, then they wouldn't have insurance. And that it doesn't take a lot to figure out what that would mean for a school district. So now, though, they're exploring different alternatives that may be able to reinstate some of that coverage, which would sort of make those liability waivers less necessary. But the big issue here that will sort of put a lot of this to bed would be some sort of action on behalf of Congress or the state legislature to say that school entities aren't liable for COVID cases or damages arising from that, as long as they follow reasonable public health guidelines and don't do anything stupid, for lack of a better term. I mean, we're all trying to make sure to do the best that we can to keep people safe, but this virus is very contagious, as Will can probably tell you. So there's no way to know exactly where you pick up, and so districts are concerned that as a government entity, people might come after them if they get sick, which certainly if they were negligent and put their employees and students in danger, that's one thing. But if they're just trying to do their job as mandated by the government, that's a different thing altogether. So that's why you're seeing those waivers coming out.
Okay, yeah, hopefully that gives parents just a little more insight on the background. And I know it varies by district. I think Queen Creek did have a waiver. Scottsdale and Peoria told me, yes, they did it for summer camp. They're not doing it for school year. So it's a kind of all over the place. That's again, a very individual situation with your school district. Will, just to kind of as a general summary, I know Garrett and Katie, they're on Facebook Live every day breaking down the COVID numbers and getting really into the data. But just kind of on a more general level, I mean, how would you describe the current state that we're in regarding coronavirus here in Arizona and the trends that you're seeing?
Yeah, so as you know, in late May and especially all through June and through most of July, we were in a world of hurt. Things were getting worse every single week. Now we're finally in a position the last 10 days where the hospitals, they have seen a little bit of relief. More people are being discharged that are being admitted. And so they have a little bit more breathing room. So that's a good thing. It looks like the trend on the number of new cases is improving, both on the percent positives and in terms of the new cases. But we can't really tell for sure because the turnaround times for these samples are so bad. And if we could get a turnaround time of about 48 hours, which the governor has now promised, beginning on August 1st, then we'll have a much clearer picture of what the data is looking like, on that statistic. But overall, I'm optimistic, and it tells me that the two key interventions are working. Number one, allowing the cities to have a face covering requirement, which they did, and many counties did as well. We know from the National Academy of Sciences, it's the number one return on investment intervention that we will have until the vaccine comes. It works. It's proven to work. National Academy shows that it reduces the spread of the virus 4% per week, every week that you have a mandate with good compliance. So that I think is a real key. Another key intervention was, stopping or pausing, as the governor said, nightclubs and bars, because they were clearly super spreading events and businesses, quite honestly. And so that's been an important intervention. Also, limiting restaurants to 50% of their seating capacity, I think, is playing a factor. But the keys, I think, are really face coverings and the pause on the bars and the nightclubs. Now, I will say, I think the face masks are here to stay. It's a normalized behavior now. And I'm comfortable that we are going to keep that in place. I'm nervous that if we allow nightclubs and bars to open again, that we will be back on the track of where we were in June and July. And I'll just throw this out there, that I think in many respects, the governor's going to have to think this through and say, I've either got a choice between in-person instruction or allowing bars and nightclubs back in action, because I don't think you can have both. I just think the community spread that results from bars and nightclubs, as we have seen, might be the factor that prevents us from having in-school instruction. So tough decisions to make. But to answer your question, things are getting better, but some wild cards out there in terms of policy.
Yeah, sure. Yeah, it's always changing. And like you said, with that turnaround time being so long, it might seem like it's going well. And then all of a sudden, a week or two from now, things can change. Stephanie, I know you mentioned in your All In Education report that you guys published. I was reading through that, and I was really struck by, like you mentioned, the communication. And I know right now communication is so important between districts and their families, really districts, their staff and their families. But as far as communicating wants and needs and being able to advocate for their students, the families that you interviewed, they really wanted to be involved in this process and involved in the education of their child, even if it was at home.
Absolutely. Yeah. The parents that we spoke to really did want to be involved. They wanted to be part of the solution, kind of given everything that we are navigating. They wanted to help. They just didn't know how to help. And there was nobody available to provide them with any guidance. And so moving forward, we are encouraging system leaders and school leaders to really think through how they engage families moving forward, because they want to be partners in this process. We're all in this situation together, and it's only working together and collaboratively that we're going to get through it. The most promising example of a collaborative effort really came out of Tucson Unified, where in their Mexican American Studies program, they had parents. I was on a Zoom call with 20 to 25 Spanish speaking bilingual moms and dads who spoke to us about their experience during all of this. And they really shared how powerful it was for them to have a space where parents could come together and share, the struggles, the questions they had, and really create that parent support network. So that the more that those kind of community supports and parent support networks can be replicated across the state, will help us with this communication challenge. But certainly it has to be prioritized by school leaders.
And I'm sure, there are so many parents out there who feel that way. And I even spoke with a mom and daughter just before this. Her daughter just started high school. Started her sophomore year of high school online, and they were just talking about, they're working through these communication issues because everyone, is so used to the traditional back to school where you show up the first week, kind of get all your info, and now it's just all online. They only see their teachers a certain amount of time. And so it's definitely going to be an adjustment, for everybody starting this school year remotely for sure. We did have a comment here from Brittany Ryder. This was about 9 minutes ago, saying they're hoping districts work with their county health departments. That seems like there is no actual accountability for truly following specific guidelines. Chris, you and I touched on this a little bit before we got this going. What is the process as far as you guys are understanding for districts once these benchmarks are out, as far as how they determine when it's safe to reopen and make sure that it actually is?
We interpret the governor's executive order to be what we would term a shall consider mandate, meaning that DHS and will issue the minimum benchmarks. You can work with your county health departments, and when those benchmarks are met, the state benchmarks are met, and you feel that it's safe to open after consulting with your county health department, you can make that decision to open. So there's no hard prevention on a district reopening, even if they haven't quite met the benchmarks, if they feel like they're close enough or whatever. That being said, we just had a conversation about liability, and we anticipate that most, if not all, school districts will not reopen for in-person instruction until the benchmarks are met. The exceptions to that being, maybe we have districts in rural Arizona where the entire student population is less than 100, and maybe they can get all of their students into school without a problem. And so maybe they'll go ahead and do that. But for your larger, more traditional common school districts that have large numbers of students, 30 in a class and up, something like that, it's highly unlikely that they'll take the step to reopen ahead of clearing any benchmarks, just because of the liability concerns involved. But technically speaking, from a legal perspective, they could open a district could open if they hadn't quite met the benchmark. It's just not advisable.
Sure. We have a running list now. We've seen some districts just kind of take it upon themselves. I know Phoenix Union's one of them, who just said, you know what, we're just going to stay remote through first quarter, or we're going to stay remote through at least Labor Day, just to give themselves kind of a plan and a set date for how they're going to handle their specific situation. But even Superintendent Hoffman yesterday said, come August 17th, that we'll probably start seeing a lot of variability as far as some of those smaller rural areas maybe being able to reopen right away with a hybrid, so they don't have as many kids on campus, or some of the larger districts having to push off for a while, just because the numbers are so much different and vary so much. Will, a question that I haven't seen it pop up quite yet here on the comments, but it's one that we hear all the time. People will say, well, if kids are going to the grocery store, or they're going to Walmart, they're going out in public with their parents, how is that safer than them being at school? Can you comment on that from a public health perspective?
Well, there's no real answer to that question, is there? I mean, so much of that depends on both the mitigation measures that will be at the school, and also what kind of mitigation does the family live with? Do the kids, when they're out of the house, do they wear face coverings? Do they wear that when they're in the stores? How diligent is the family about hand washing and so forth? So I don't think there's a single answer to that question. For those families that have been super diligent over the summer and have been working from home and have had really strict mitigation within their family pod, and then a school district opens again, hopefully they do that after the community spread slows down. It's a fact of life that there will be more risk than there was when they were in their home using their own mitigation within their own pod. And so you have to balance that. All families really are going to have to balance the risks and benefits. Well, I mean, families do that all the time, just not with COVID-19. That's a new thing, but families balance risks and benefits all the time. Mm-hmm. And this is a new risk and benefit calculation that parents are going to be making about what's the benefit for in-person instruction, and does that outweigh the risks that my child will be exposed to COVID-19 while at school, not because the school did anything wrong, but just because, as you said, it's a contagious disease, and you don't know where you're going to get it. But it's ultimately, that's what it is. It's risk benefit. And, families, parents, students, older students will be weighing in on that too, I think, helping to make those decisions with their parents. So that's what it kind of comes down to in the end.
Yeah, those very personal, local level decisions that will have to be made. And Chris, I know some districts have expressed a lot of concern over reopening when they don't necessarily have a clear idea of the protocol of if and when someone on campus gets coronavirus. Do you close down a classroom? Do you close down multiple classrooms? How are districts navigating that in their planning when we don't really have exact guidance just yet? I'm told it's coming, but they mentioned that a few weeks ago too. So hopefully it'll be coming soon. But I mean, that's got to be tough to think of how you can open schools when you're not really quite sure what to do if and when that happens.
Yes, and it's compounded by the fact that technically speaking, right now, there's no requirement that if I test positive for COVID, I have to tell my employer or my child's school. So I could keep that information to myself. Then that creates a whole host of other problems. The CDC recommends that if you have a case that you become aware of, that you close down for, a period of time, a few days, at least those specific areas to deeply clean them. So we would hope that would be advised. We know that just because of the way things are going in Arizona, that it's possible that, and even likely that someone will carry COVID into the school eventually, and we have to know what to do about that. So that is something that we absolutely need to hear from DHS on, and we hope that's coming August 7th or soon thereafter, because that is a big concern about not only do we want to be able to keep students safe in the environment, but we want to be able to mitigate the spread if and when it comes. And we need to know, the biggest point here is that school, and I've seen it a couple times in the comments as well, school district officials are a lot of things. They can make all the educational decisions in the world, but they're not public health people. So they really need folks like at DHS and folks like Wills Association to provide guidance as to what those protocols need to be so we can execute them. Without that, we're sort of thrashing around. And I'll just make a point about risk as well. Polling students, families on this is kind of a futile exercise at this point. You put out a survey and it comes back 50-50, and you're just having to make a judgment call about what the families in your district are going to respond to when they're pretty evenly split on a lot of issues. So it really is about managing risk and assuming those responsibilities as an elected official to make the decisions.
Yeah. Will, did you want to chime in on that as well?
Yeah, just real quickly. I wanted to say the more we learn about this virus, the more we understand that it really is a respiratory droplet virus. That's how it spreads. And so the symptom check part of the protocol, I think, is the most important part of the plan. Is when students come in, how are they screened? When teachers observe a cough or a symptom that could be COVID-19, how do they react? Is there a place for that child to go into isolation? That part of it, that human element, is, I think, more critical than the disinfection piece. The disinfection gets a lot of attention and quite honestly could be really expensive and not worth it. If you shut down a school and do a $10,000 disinfection, when in fact what you could spend is $10,000 on masks and training so that teachers know where the isolation room is and how to detect symptoms of COVID and those sorts of things. So the symptom check part of this is really critical. The other thing I just wanted to mention quickly is, we've got to get to a place where testing is a lot easier and more convenient in order to pull this thing off in schools, because you're going to have to do some focused testing if you get a case within a school or school district. And right now, we still have issues with testing. So that's why the percent positive is an important component of the gating network, of the gating criteria, because if you can get to 5% positive, that tells you that testing has become easier. And so that's just going to be a real important part of this, because testing and symptom checks are, I think, probably among the very most important mitigation measures, along with just being able to physical distance and the face covering requirements within the mitigation plans of the schools.
Yeah. And Stephanie, go ahead.
just real quick, as you know, Chris hit the nail on the head here, like expecting school leaders, governing board members, and superintendents to be public health experts is just, it's a flawed, process. And certainly from a perspective in Phoenix Union, we were doing more and more focus on logistics and operations and how we were going to properly physically distance and do temperature checks and do all of these things without having additional guidance from public health officials. And we were focused so much of our summer on that. And really, it took us away from what we are experts at, which is teaching and learning and delivering high quality education to all of our students. And our decision to do all of Q1 in distance learning was met on, we got to get better at distance learning. That's the safest option on the table right now. So we have to get better at it and provide the professional development supports, the family supports that are needed, et cetera. And it also provides time for, the public health recommendations to be set in place. And it gives our families the planning time that they need to appropriately adjust their home life, if that's what, plan for daycare, things like that. So just we did a longer term decision because one of the feedback that we got was that the families were getting frustrated, and our educators were as well, with that week to week unknown. And so the more that we can give families planning time, some sense of stability, is I think the best option for school leaders right now.
And I'm so glad that you said that, Stephanie, because, I told you before we got on the call that, Dysart just pushed back to October. Tolleson Union High School just pushed back to October, that district. Gilbert is doing kind of a wait and see, where they're going to wait until they hit the benchmarks. And if they haven't by September 22nd, they'll revisit. So I think our growing list of, it's got to be getting close to 24 by now, of districts who have on their own decided to push back to Labor Day or October for that very reason that you just mentioned. So I'm so glad that you gave that perspective as a governing board member who's trying to make these decisions. Well, I can't believe it. We only have a few minutes left. I feel like this flew by. We could all clearly talk for much longer than 45 minutes about everything that's going on in education. So just before we sign off here, I want to give each of you just a chance real quick, if there was any other point or any other message that you think needs to be conveyed right now. Chris, I can go ahead and start with you. Anything else that you guys want to make sure people know you're doing or working on right now?
We as an association are committed to pushing state government to get these guidances out as much as possible, as fast as possible, so we can have some more certainty. I think the biggest thing that parents need to know is that if you haven't been connected to your local school district, it is not too late. You should be on their website. You should be scouring it. You should be emailing your governing board members. If you need something from your school district, you should get it. And so if you need an answer to a question, you haven't gotten it yet, even if that answer is, I don't know, they should be able to tell you, I don't know. We're still working on that. That's sort of the thing to do. So, and there's a lot of that. I mean, the biggest thing about this is that even though we have a lot of decisions to make, they're all coming very quickly, and some we haven't gotten to yet. So I know that's frustrating. I know there are communication issues out there, but Arizona's locally elected governing boards and their superintendents are working overtime on this issue 24/7, 365 almost at this point. So, a little bit of patience goes a long way. I know involves your children, and that's tough, but we are working and we are trying to get information out as fast as possible. So thank you for the opportunity to be here today.
Yeah. And Will, what about you from a public health perspective? What do you think people need to be thinking about right now?
I'm going to give them hope. That's what I'm going to do. I spent the last week really looking at the vaccine trials that are underway. There are close to 18 vaccine trials across the world that are happening. Some of those are moving into phase 3, which is the final testing phase. One of those testing sites for the Moderna vaccine is here in Arizona because we have so much community spread. That's in a phase 3 trial of 30,000 people. The phase 2 trials have been very encouraging. Both T cell, which is your killer T cells within your immune system response, also antibodies. Side effects have existed within the vaccines, and there are some, but they are not clinically significant. And so I know this has been people have been dealing with this, really since March, and sometimes it feels like there's no light at the end of the tunnel. But these vaccine trials are actually very promising, and you will hear naysayers and negative people on the national media and otherwise that get lots of attention who are going to warn you that probably there's not going to be a vaccine, or that's going to be really, really a long time from now. But I'm here to say I've looked into it, and I spent a lot of time on it actually all last weekend, and I'm really encouraged and actually quite optimistic that we'll have a vaccine for the spring semester.
Love having some good news and some optimism in this. So thank you so much, Will, for bringing that. And Stephanie, anything else either, as from the advocacy side or the governing board side that you want people out there to know when it comes to education right now?
Certainly. What this pandemic did is it really exposed it exposed all of the inequities that we have known have existed in our education system for an incredibly long time. It is why we have a gap in attainment between Latino students and their white peers. And so for us, it is absolutely important and critical that parents get involved, as Chris said, get involved with their local school district. Talk to their governing board members, talk to their school leaders, and find ways to really be partners in this process, because we are navigating an unprecedented year and we need partnership with parents to make sure that our students don't fall behind and that they get the resources that they need to continue to learn as we navigate this school year. And then certainly for our system leaders and policymakers, they can get a copy of our report with all of our findings and recommendations at allineducation.org/report. And we'll be sure to share that in the comments as well.
All right, excellent. Thank you so much again to all of you who have been watching for the last 45 minutes and for all of your comments. We really appreciate you being part of the conversation. Stephanie, Will, and Chris, thank you so much for your time and your insight. I know people are just craving information, and so we really appreciate you joining us in this effort. Don't forget, you can track your district and others at abc15.com/schools. And if you missed the beginning of this town hall, you can go to abc15.com/town hall, and we will have all of our town halls that we've done posted there for you. So we're going to go ahead and leave you here. Carla and I will be back tomorrow morning at 10 a.m. For another Facebook Live, just giving an update on education and what we can look for going into next week. So have a great day, everybody, and thank you again for your time.
Thanks.
Thank you.